The Active Living Health Pathway initiative is a programme of 12 weeks to support individuals with long-term health conditions who are currently within an NHS pathway. So we are supporting individuals with long-term health conditions specifically around pulmonary, respiratory, falls and frailty, and then a range of other long-term health conditions.
Well, I had 2 spine operations, one damaged nerve at the top of my spine, and also I'm waiting for a knee replacement as well. And I was getting that I couldn't walk very easily, and I had a couple of bad falls. So the doctor thought it would be good while I'm waiting to have this knee done, come and see Tony.
The strength and balance classes, the aim of it is to help people improve their strength and balance. It's for people that are at risk of falls. We do sit to stand, so when you're in a seated position, when you're in a chair, you go into a standing position. Another example is they do standing leg curls. So basically, a lot of the exercises concentrate on the legs and strengthen the muscles in the legs.
Being physically active is one of the most important things that any of us can do for our health. We now know from lots of research and health professionals that it's actually safe and good for people with things like diabetes and heart disease to be physically active. And so the West Suffolk Foundation Trust really wants to support our patients with long-term health conditions, and then partnering with somewhere like Abbeycroft means that there's people there who can work with people in a more one-to-one or a small group setting and really help people through those first days of exercise where it can seem a bit daunting. Obviously the Foundation Trust is very experienced and expert in the clinical care, but we recognise a partner like Abbeycroft is well established in our local area, and we've been able to work really well together and do some really high quality evaluation to see that this partnership is actually making a difference to people's lives.
Since I've been coming regularly, I've started to remember to do a little bit while I'm watching telly. So, you know, do a little bit of ankles and knees and things. So it gets it into your brain, come on, do a little bit more.
The physical situation was I was very uneasy on my feet. I couldn't balance, it was very hard to walk. The improvements have been brilliant. There was a lot of things I couldn't do, which I can do now. Social side has been amazing. I've made some wonderful friends, and I've even met people that I knew 40 years ago who I hadn't seen. So the social side has been brilliant.
It's done everything for my confidence. I go off in the car now and drive and do my shopping or whatever, and I just feel so much better for it.
I got referred to here because I'm an ex-cancer patient. The exercises here are excellent. I'm actually being able to walk without falling against the wall when I go up and down is definitely of benefit to people who are suffering.
To be able to sort of share in some of our patients' journeys, to hear, you know, that actually our team have really helped change people's sort of daily lives for the better. You know, they've built friendships, they've built support networks, and they're doing things that maybe, you know, just 6 months ago, a year, they thought they weren't going to ever do again, and actually that's really powerful and something that we find really rewarding on a daily basis.